record.
Hello, Nowata County. Today is Tuesday, May 10th, and it is National Fentanyl Awareness Day. And we are here with the District 4 Health Department. They cover quite a few counties, and we will be back with introductions here in a moment.
Our mission is to promote strategies and policies which ensure improved health for all citizens of Nowata County.
Okay, we are back, and I will let these guys introduce themselves with the Health Department.
Sure. I'm Kelsey Walker. I'm the Public Information Officer for District 4.
I'm James Thompson. I'm the Regional Director for District 4 of the State Health Department.
I'm Taylor Thompson, Community Engagement and Health Planning Manager, and we're not related.
Okay, so you said District 4. Will you explain what counties those cover?
Absolutely. That includes Craig, Delaware, Mays, Ottawa, Rogers, Nowata, Wagner, and Washington. I get everybody?
So kind of just a little bit, for those, we like to say, well, we're covered by whatever a certain health department, whatever county you're in, you can go to your neighboring health department. Is that correct?
Correct. So, any county, local county health department, anybody can come receive services there. You don't have to be a resident of that county to receive services there. You just have to show up at that county health department and get whatever service you need currently at that health department. There are certain counties throughout the state that don't have a local county health department. Nowata happens to be one of those.
Right.
And so if a resident of Nowata County lives closer to Craig County and Veneta, where our county health department is there, best place to go would be there. If you live on the south end of Nowata County, closer to Rogers County, and it's easier to get to Claremore, happy to see you there. If you want to drive all the way to Miami or to Wagner or to Coweta to come see us, we'd be happy to see you there too.
I think that clears up a lot of questions. I think some people thought that they had to go to Washington County under a certain county. So
No.
I think that clears up a stigma that we had.
Good.
So
All right.
we will let you give us a little background information.
Sure. Well, we are here to talk about our mobile wellness unit, which tries to stop in Nowata County once a month. A little bit about our unit. It was OSDH mobilized a whole fleet of wellness units actually last summer, I believe. Every district got one, including District 4. And those mobile wellness units were purchased with COVID relief funding and delivered to all 9 of the health districts. And the idea is they are portable, so they can go out there and really reach people where they're at and get some of these rural, underserved, or minority areas
Absolutely.
that we're trying to get to. And so we take our mobile wellness unit to a variety of settings. We've gone to churches, schools, community centers, homeless missions, and we will be coming to Nowata to Spikes Park on May 18th. That's our next stop in Nowata County. I think that's a pretty good overview.
Which, just a reminder, May 18th.
May
we're doing
18th
it. Yes.
from 10 a.m. to 3 p.m. at Spikes Park.
And that is the same day as our opening day of farmers market. So come visit the health department and stay a little while and visit the farmers market on that day.
So our health departments have a variety of different services that we offer, all of which are not available with our mobile unit. So it is basically a fifth wheel trailer that we pull behind a truck that shows up, and it's an enclosed, what am I trying to think of, Taylor?
Like an RV.
It's an RV, and it comes in with a complete clinic setting. So we have all kinds of different basic primary care needs that we can meet through that. So we have a family nurse practitioner that travels with that mobile unit. She's become a professional driver, along with being a nurse.
Lucky her.
And, right. So probably not one of the things she thought she was going to do
Right.
when she joined the health department. So we travel all over the 8-county district that we have, different areas, trying to set this up. What we found has been most successful with the mobile unit is partnering with other groups like the farmers market, different churches, different places that have other activities going on.
Absolutely.
It gives us more of a bang for our buck. You know, the more people we can see all at one time for multiple venues, the better off we are. So our goal is really to try, in our district, one of our main things has been to reach people where they're at.
That's what I was just
this
fixing to say.
mobile
We go-
unit really is about engaging with people at their local home base instead of having to drive 30
Right.
to 45 to hour and a half to a health department. So through COVID, we found that reception throughout the community was very well received when we were out doing pods with vaccines and testing. So we had many partner agencies and groups that provided places for us to be off-site. So having this mobile unit helps us do a lot more than just COVID, and be more of a benefit to the community and the citizens that are out there.
Because the people will come, if it's something they need to be seen for, that's a smaller issue. They're more likely to come right here in town rather than drive that 30 or 40 minutes
Correct.
to a neighboring community.
And it helps us in a way. So, the health department, we have a variety of services that we offer. We do a lot of different things, but there are things we don't do. But we also have connections through community health workers, and Taylor can talk a little bit more about that here in a minute, of reaching out to some of these other resources that are available. As much as it pains me to say, most people in the community don't know what resources are available.
Absolutely.
And they don't have that instant access. Not to say we're 100% efficient at all those places either, but we're working on it. But we have a lot better resource handout pamphlet that we can connect people with. One of the things we're trying to get better with at the health department is not just giving someone information about a sheet, but really having those hard handoffs and referrals to be able to coordinate that care better with individuals across all different planes and different avenues of service.
What we see here is if they have to make that next step, they kind of sometimes stop. So if you
Yeah.
can help them get to that next step, they're more follow through.
Exactly. And that's something that the Oklahoma State Department of Health is really focusing on right now, is our community health workers and getting them mobilized and engaged with our community members. So, for instance, if someone comes to the mobile unit when we're in their county and they're seeing that one time for something, but say it's a chronic issue and they need follow-up for that, well, we won't be able to handle that follow-up, but our community health worker can refer them to a medical home where they can get further care.
Right.
So it's really beneficial to the person that way that comes to us. And then they can also connect them to other resources. It could be food, shelter, clothing, whatever it may be. Our community health worker can take that time and help them walk through that process and kind of navigate those systems,
Absolutely. Yeah.
or get them signed up for things. So it's a really, really good program, and it's brand new for the state, and we're really excited about it.
That sounds very exciting. We're gonna have to get in on that. So
Yeah.
because it's more of a wraparound service
Yeah.
for the community.
Very much so. And so District 4, our mobile unit, we were fortunate enough to be the first mobile unit out on the road out of the 10 that are out there. And so we probably got a little bit more practice with ours. And we are very fortunate with the nurse practitioner that we have, Ashley Roberts. She has done a fantastic job of really grabbing the bull by the horns and really embracing what she can do with the mobile unit services. Again, this is all new for us, as Taylor said, so we're still learning as we go and trying to develop the policies and the approaches that need to go along with that. So there are things that we can't do. We are not a primary care facility. We are not a patient-centered medical home. We are also not an urgent care. So if you break your leg, cut off your finger out, working in the
unit is
field
not
or
the
something,
place.
that's probably not the place to go. We'd be happy to slap some duct tape and super glue on it and send you on your way to the nearest
Right.
emergency room. But that's not what our focus is. It's more about that screening service and introductory service for those individuals who may be pre-diabetic or have high cholesterol or things like that. Those are the services that we can help get them connected into that primary care setting. We have a story where we had an individual who came in, and our staff on the mobile unit was able to help sign them up for Medicaid expansion and get them enrolled in sooner care, and then from there help them find a primary care home and really kind of change a whole person's way of
Absolutely.
being just from one visit. And so that's really our goal, is what's the biggest impact that we can have on an individual in the time that we have with them. Healthcare has been a weird animal for the last
It has,
10 years.
yes.
There have been a lot of changes. We've gone from quantity of care to quality of care to back to quantity.
Yep.
Now this weird split quality and quantity metric. And so we're trying to, as the health department, find that right balance for what we do in public health and how we reach out to the community and the services that we provide. Again, there's so much more than just that healthcare aspect with public health. So, we take care of food and restaurant inspections. We take care of early childhood development issues. There are so many things that we do across the state that we probably don't give ourselves enough credit for.
Absolutely.
And we're fortunate enough that through COVID, or unfortunate enough that we've gotten a lot of media time. And so we're trying to take full advantage of that in regards of using that as a base to really share a lot of the other resources that we have access to, and the staff that we have who truly have a heart to serve people where they're at and really meet the needs of the communities that they serve.
That's awesome. What are a few things that you do other than like the care on the mobile unit? Do you do like car seat?
We do,
Check
yeah.
out,
So we have certified car seat technicians, and often we do bring them with the mobile unit to do those car seat checks. So, say a mother brings in their child for their immunizations on the mobile unit, well, then we can also check their car seat out and see if it's installed correctly, see if it's safe, and sometimes if they qualify, we can get them a new car seat if they need one too. So we do that every day at our health department. So Washington County Health Department, Rogers County Health Department, Craig County, those ones that are close here to Nowata. You can visit any one of those, and there's a car seat technician there that can help you. Or if they're not available that day, they can set up a time to help you.
Okay.
We also have a lot of maternity care type of things, pre-pregnancy and post-pregnancy. So we have a program called Children's First that we can get residents involved with our nurses that can help them. So first-time mothers in their first and second trimester, we can get them enrolled in that program and really go through that process about what it's going to be like to be a mother and some of the expectations all the way up through 2 years old. Once a baby's born, we have a Sooner Start group that can help with identifying any type of early issues that might be. We have hearing screenings that we can do. We can sign people up for women, infants, and children. We're actually working with piloting some programs with DHS to try and coordinate some efforts for signing people up for SNAP as well on the mobile units. So really looking at a way that we can try and coordinate so we become a one-stop shop.
I was gonna say you can get everything in one place.
That's it. So
and that's something that we want the community to know about is we have these great like family programs like Children's First or our guidance program or WIC. We're not just COVID.
Right.
We handle COVID and we do that if need be, but we have all these other things they can get involved in that often in the private sector may be unaffordable or
Right.
unattainable.
And I think that's just a lot of getting that information out there that people don't know that that's
Yeah.
available.
Yeah. So I think the best thing to do would be if anybody has any questions about what type of service the public health department has, or they have any questions, feel free to call your local county health department. We'd be happy to answer any of those questions. If we don't have the answer, I for sure guarantee we'll
You can
find
find
it.
somebody.
And if not, if it's not a service we provide, we will definitely refer you out to that appropriate organization as well.
What about eyeglasses?
That is something that we are in the works on.
I just got off a call that wanting to know what that, and I'm like, hey, I just know the people.
So dental care and optometry are two of the things that we have begun starting to talk about here in our district about how we can meet those needs as well. So in Rogers County, we are actually getting ready to start a remodel of that building, of that facility, to bring it up to date. We have a dental suite there, so we're working on remodeling that dental suite and then working on bringing in a dentist, probably starting once a month or once a week to try and coordinate some dental care and see what the needs are, and then let it grow from there. Taylor and I specifically have been talking a lot about how we can branch into optometry. Right now we do basic visual screenings, but we don't do actual glasses or eye exams. And so how do we get into that business, I guess, for lack of a better term? But we're working on a lot of those opportunities like that. And we'd be happy to refer people out. Every county has different assets. So depending on where you're at and which county health department you call, we'll have different resources based on that county and that area. So.
Okay. Well, we'll have them give you a call then.
Yeah.
Sounds
Perfect.
good. Is there anything else that you think we would need to cover if we ended right now?
Well, just know that when you see that mobile unit out on the road, it's a Dodge dually truck pulling this trailer.
You can't miss it.
You can't miss it. It's not branded great, so it's kind of hard to tell what it is exactly, but it is our mobile wellness unit. So feel free to stop by, knock on the door, see what we're offering that day. We try to help as many people out as we can on those times that we're in these locations. So just check our Facebook pages. That's a good place to find our information about where we're going to be at next, because we may not be in Nowata, but we may be over in Washington County or somewhere close.
Right. And when they're in Nowata County, we always try to catch that and share that on our Facebook page too, for all of our followers. So, Marcus, do you have anything else you need to add?
No, my mind started racing about questions, and then you guys answered them as soon as I got done thinking about it. So that's fantastic.
Good.
I did pop over to, I'm going to put this back up here one more time. Another thing that I thought about was oklahoma.gov/health/mobile wellness. If you don't have Facebook and you're and you're still computer savvy, I guess. But other than there's the mobile unit right there. So
And we do also, Kelsey does a great job of putting our monthly schedule in the local newspapers. So every month there should be an article or a little snippet, at least towards the first part of the month or the end of the previous month, that'll have a schedule of where our mobile unit will be throughout the entire district as well. So
That sounds great. All right. Well,
guys, thank you for coming. And
Yeah.
by all means, any other events that you have, any health and wellness things, that's what this podcast is here for. Come back and we'll help you advertise it, get it out to the people. And if you just have some new, interesting things that people in the community need to learn about, come back and say a few words on camera for us.
love
right.
to. Thanks you guys
Yeah.
for having us.
Thank you.
thank you.